Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. More and more people, even young adults, are suffering from sudden cardiac arrest. This is due to sedentary and stressful lifestyles. Now, without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving interventions passes. It has been proven that bystanders CPR improves the rate of survival by almost 50%. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. You can also WhatsApp us your questions. The number is on your screens there. We have with us today Dr. Avadhesh Narayan Khare, the consultant interventional cardiologist, Dr. Avadhesh Narayan Clinic Bhopal, Dr. Sachin Hundekari, Synergy Heart Institute, PCMC Pune, Dr. Hundekari's Elite Heart Clinic and Pathology Lab Pune, and Dr. Amit Munjal, consultant interventional cardiologist, Munjal Heart Care Center, Fatehabad. Thank you so much, doctors, for sparing your time and joining us on the show this afternoon. Dr. Munjal, first to you, cardiovascular diseases have now become the leading cause of mortality in India. Why are Indians more prone to cardiovascular diseases?
Good afternoon, ma'am. Yes, very correctly said that cardiovascular disease has become leading cause of mortality not only in India but worldwide also. There are 3.24 million myocardial infarction and stroke worldwide every year. Cardiovascular diseases is estimated to be leading cause of death and disability, of which coronary artery disease is major contributor. Currently, ST elevation MI compromises 25 to 40% of coronary artery disease presentations. There are many risk factors for coronary artery disease, out of which few modified risk factors are smoking, hypertension, diabetes, dyslipidemia, obesity, stress, bad dietary habits, sedentary lifestyle, alcohol. Cigarette smoking has a number of adverse effects on cardiovascular health. LDL-C, which we also call bad cholesterol, was directly associated with cardiovascular diseases. A 10% reduction in serum cholesterol produces drop in CAD risk by 50% is at the age of 40 years, 40% is at the age of 50 years, and 30% is of 60 years. Patient can improve lipid level and decrease the rate of cardiovascular events by adding specific foods to their diet, like intake of soya products, legumes, garlic, fruits. Decrease LDL and total cholesterol without decrease the HDL levels.
All right. Dr. Khare, people who are 30 to 40 years of age are having heart attacks and serious heart problems. What is the main cause of a steep increase in heart problems among the young?
Yeah, actually there are risk factors are also increasing because of the fatty streaks formation started early at early age, and the diabetes is starting at early age, and hypertension is also started at early age. There is a smoking, they are strained toward the smoking. People are doing smoking at early age, and then substance abuse also contribute to it. And also, as you said in the initial program, the lifestyles and the junk food habit which we are now doing, that the taking more or more trans fat, which all are increasing at risk of sudden cardiac arrest. So we have to regularize our lifestyle and also move and to do more physical activities and avoid substance abuse, and also regularly check up for diabetes and hypertension screening. So if we have any risk factor, we can treat it and regularly can control them better way.
All right. Dr. Hundekari, now you probably wouldn't ignore a pain in your chest, but people often dismiss pain in their legs, as there can be multiple reasons behind leg pain, which are generally related to overwork and physical stress. Can heart problems also cause a pain in the legs?
Yes, Gargi, many patients who present with leg pain doesn't have directly heart attack symptoms. It is not a heart attack symptom, but the few heart conditions can lead to development of leg pain. One such condition is called heart failure, where the heart is not pumping properly, and because of the leg vein engorgement, people will complain of some discomfort in the leg, swelling in the leg. Second condition, what we call as venous thromboembolism, it's nothing but the clots in the leg veins, which can also lead to swelling over the leg, and patient may subsequently have what we call pulmonary embolism. Third important cause is a peripheral arterial disease. It's nothing but the blood supply to the peripheral blood vessels is reduced. So because of the blockages inside the arteries in the leg. So such condition doesn't directly correlate it with the heart, but it is coexistent with the heart attack, or a heart attack predisposes. So the 50% patients with peripheral arterial disease have associated coronary artery disease. So if your doctor diagnosed you to have blockages inside your leg vessels, it is prudent to check with your doctor if there is associated blockages inside your heart vessels also.
All right, Dr. Munjal, a heart attack is dangerous and fatal. Some people get a mild heart attack. Is a mild heart attack a warning sign, and what is the difference between a severe and mild heart attack?
Ma'am, heart attacks are divided into two types according to changes they produce in ECG. One is ST elevation MI and another is non-ST elevation MI. ST elevation MI is generally caused by complete and persistent occlusion of coronary artery, whereas non-ST elevation MI is generally caused by partial and intermittent blockage of artery. Yes, mild heart attack is a warning sign. Patients with previous MI are highest risk group for further coronary and cerebral events. Patients who had mild heart attacks benefit from early treatment to reduce risk of further MIs and other cardiovascular manifestations.
All right, Dr. Khare, it said that men are significantly more likely to have their heart stop suddenly compared with women. Is this correct?
Yes, it's true. The men are more likely to develop heart attack because the females are protected by their female hormones, which actually protect them. There are less chances because of the most of the sudden cardiac arrest or the heart attack is because of this heart attack. So they are having this favorable female hormone which protect them from the this heart attack at earlier age. But at the age of after 55 years of age, there are less chances. The chances become equal. And also there is some sudden cardiac arrest because of this hypertrophic obstructive cardiomyopathy, which is also common in men. So what the other things are common in men and female both, but because of the most of the sudden cardiac arrest because of this coronary events which are common in men, so that is why the men are more likely to risk for the sudden cardiac arrest because than female.
All right, Dr. Hundekari, does CPR apply in both conditions of cardiac arrest and heart attack?
Yes, Gargi. Actually, CPR is cardiopulmonary resuscitation. This condition in patients who have the complete stoppage of the heart and pulse because of any condition like heart attack, which leads sometimes to a systole, or what we call a flat line, where the heart stops temporarily. So in such conditions, we start CPR. So with the CPR, patient's heart can be revived if given promptly and at a good rate. So it is very important that every heart attack patient doesn't need CPR. But yes, few patients who develop a cardiac arrest because of heart attack or some other conditions, they require CPR, because if the CPR is given on time and at a good rate without interruption, they can save many lives. So it is very important that you should analyze the patient initially, whether the patient is breathing, whether the pulse is present. If the pulse is not present, if the breathing is stopped, you can immediately start CPR, and the CPR can save many lives.
All right, so good to know that CPR can be used for both cardiac arrest and heart attack. Now, Dr. Munjal, now let's come to the issue of CPR. Lack of CPR awareness is a big challenge in India. Please tell our viewers about what are the main steps of CPR.
Ma'am, in my view, to overcome this lack of awareness, you correctly said there is lack of awareness. Private hospitals and government hospitals should come forward to start public education campaign to provide CPR training to public free of cost. Public should be educated about STEMI, early recognition of signs and symptoms of heart attack, and importance of getting heart attack patients to hospital as fast as possible. And regarding CPR, full form of CPR is cardiopulmonary resuscitation. It is a series of life-saving actions to improve the chances of survival after cardiac arrest. Like acute coronary syndrome is the leading cause of sudden cardiac arrest. Earlier CPR was ABC, airway, breathing and circulation, but in latest guideline sequence has been changed to CAB, circulation, airway and breathing. Early establishment of circulation by chest compressions and defibrillation has been given priority in latest guidelines. If you see a patient of sudden cardiac arrest in your vicinity, not breathing, not moving at all, don't panic, do not run away. Before starting CPR, call for help, call for ambulance, act in a right way. If you act in a right way, just you can save a life. Palpate the thyroid cartilage, generally roll down the fingers and feel for carotid pulse for 5 to 10 seconds. Chest for responsiveness, check for respiration. You can be able to save lives. You can check for responsiveness by asking, open your eyes, or are you okay? Then start CPR. Do it with correct technique. Push fast, at least 100 to 120 compressions in a minute. Push hard. That means 5 to 6 inches recoil should be there for effective compression. Flat of your palm should be in contact with the middle of sternum, like 2 centimeter above the sternum. In latest guidelines, do not warrant about mouth-to-mouth respirations. So CPR correct technique is very important.
All right, very important for everyone to know more about this, and for those, as you said, hospitals, etc., to create more awareness about CPR. I will slip into a short break now and return with more questions for the doctors. Do stay with us. Welcome back. You're watching Health and Wellness. We're talking about heart health and CPR, and let's go across to our panel of doctors. Dr. Khare, before the break, we were talking about how you can, the process of CPR. But if you can tell us, can you damage someone's heart if you perform CPR while it's still beating?
Yes, we should not worry about the complications. Actually, we are reviving the patient who is already dying. The CPR is cardiopulmonary resuscitation. You are actually reviving the patient. So never worry about the complication. And the actual damage of heart is very rare. Actually, the compression can lead to the rib cage, which can break. The rib bone can break. And so this is actually when the CPR is effectively, it is bound to get break, because we are externally compressing the heart to maintain the circulation in the brain. So we have to break the bones in the rib cage. So that is common, and we should not worried about it. There are other organs can also be damaged if they are brittle, like if or there is underlying disease like liver can be damaged. There is a laceration in the lungs. There could be laceration in the spleen. But the heart damage as such is rare. But there could be pericardial effusion. Some other complications can happen. So those are also rare, but the most common complication is breaking of the bone and the broken of the rib cage. So that is going to happen. We should never worried about that thing, because we are going to save someone's life. So never worried about complication. Go ahead with the CPR whenever you think that the patient is collapsing because of the heart is stopped beating. Just start CPR immediately. Call for help and immediately start CPR. As the sir has already described, do more than 100 beats per minute and start doing something. It should be effective. It should be such a way that you compress it and the cage of the ribs should be break down, so we can actually compress the heart externally.
All right. Dr. Hundekari, how does an automatic external defibrillator help a person who's in cardiac arrest?
Yes. As Dr. Munjal just told about CPR, ABCs of CPR. Now the fourth component is D. So it is ABCD of CPR. So D is nothing but it is a defibrillator. It is automatic external defibrillator. Once we give CPR, the chances of survival of the patient is increased to 5 to 10%. But with addition of the defibrillator in the CPR, so it can increase the chances of survival by as much as 20%. So AED is nothing but an computerly programmed machine which is able to detect the rhythm of the patient and there are the few rhythms which are called shockable rhythms. Shockable rhythms means which can be shocked and the patient can be revived with the machine. So what is AED? It is nothing but a patch of an electrode that is applied to the bare chest of the patient, one on the right side, one on the left side. And after that, the machine will sense the patient's rhythm and it will see whether the patient's rhythm is shockable. So once it is shockable, so it will tell you to get away, and then you have to push a shock button. Once you put a shock button, it will give a shock directly on the chest wall so that it can transiently stand still and make the rhythm normal in the recent times. So it is very important that once you apply effective CPR, and if you after giving CPR, you have to reassess the patient's rhythm and see if aid is available. Initially, aids were not available easily everywhere, but now it is made available at railway stations, it is available in the airport, it is available in the gardens and public places. So with this CPR, we know that many lives can be saved, and with the effective application of AED, many more lives can be added. So it is very important to be aware of the AED, and it's used not for only for doctors or health workers, but it is also useful if we know the use of proper AED in the general population also.
All right. Dr. Munjal, if you could tell us, what is the role of cardiac rehabilitation for patients who've suffered from a cardiac arrest?
Cardiac rehab mainly emphasizes on overall risk factor and behavioral modifications. Purpose of cardiac rehab is to minimize the effect of cardiac illness, to increase functional capacity, decrease anginal symptoms, decrease disability, improve quality of life, and modify coronary risk factors. Cardiac rehab session should start within 10 days of discharge from the hospital. Medically supervised exercise-based cardiac rehab program is even safe for patients over 65 years of age. Cardiac rehab can be done in 3 phases. In phase 1 is early mobilization and patient education. Phase 2 is medically supervised OPD-based exercise program where patient can exercise 3 to 4 times a week and total 36 sessions in 3 to 4 months. And phase 3 is non-supervised, non-ECG monitored exercise program for at least 6 months, which can be done from home also.
All right. Dr. Khare, if a person suffers from heart disease, what type of exercises should they do? And, there are also reports of people collapsing while exercising. So how important is this?
Yeah, there are 2 types of patients who are at risk of developing heart disease, or who already have heart disease and their heart is compromised. So already, as I was told, that when there is this disease already there, then we should gradually start. But those who are healthy are not having heart disease and they want to decrease their risk of their heart disease, they should do 30 minutes jogging. This is a moderate intensity jogging. Do not do run away and do strenuous activities which are actually harmful. And always the warm up is always important. So first do warm up, then do intensify your the exercise, and this intensity which is useful for the heart is at the 80% of your heart rate should be achieved, which can be, if you want to calculate it, 220 by minus your age, and then 85% of that which should be achieved. Not go for the strenuous activities, because which can sometimes lead to fatal. And those who are actually having this heart disease, their heart is damaged because of myocardial infarction or heart attack, they should avoid doing this strenuous activity at all. They should do the mild intensity exercise, or then gradually build up over the period of time with proper this guideline and with proper instruction. They gradually can increase, but never go for the highest intensity without taking another medication. Or there are sometimes patients having heart attack which the vessels are not revascularized, like they are not undergoing any revascularization procedure like angioplasty or angiography. They are still having some stenosis in their vessels. Then those patients should avoid it. And for athletes also, if they are at risk factors, like they are in family history of having this heart attack, or their family history of sudden cardiac death, they should be screened by ECG or echocardiography that their heart is healthy and they can go for the strenuous activities. So that way the person who are having some history in their family, they should be properly evaluated, and those who are having free of any symptoms, they are not having any disease, they can do moderate intensity exercise, that is light jogging, and can do it for 30 minutes and then 30 minutes a day, that 4 to 5 6 days in a week. And those who are already having heart disease, they should regularly do it with the proper instruction by their cardiologist or physiotherapist, that ask them properly how much they can do, because the variation in their ejection fraction, how much there is revascularized or unrevascularized status, all these are actually affect their heart. So this should be individualized rather than generalized.
All right. And finally, Dr. Hundekari, is there a link between dietary cholesterol and heart disease? If you could explain that.
Yes. It is an area of controversy initially, because initially we used to limit the cholesterol intake, and it was been thought that dietary cholesterol excess can lead to heart attack. But in the recent guidelines, once we see that American Heart Association from the late 90s, they have removed that restriction of dietary cholesterol for prevention of heart disease, because it has been seen that the high cholesterol level in the diet doesn't correlate with your bad cholesterol inside your blood vessels. But yes, if there is high cholesterol, which is called trans fat or saturated fat, if it is in excess, it is going to increase what is called your bad cholesterol or LDL level. So that is dangerous. So it is advisable that you should restrict your saturated fat intake or trans fat intake less than 10% of the total food. And it is very important that whenever you are consuming anything in excess, it is going to deposit in your blood vessels. So even if you are eating more of carbohydrates or more of saturated fatty acids and trans fatty acids, which is commonly present in the red meat, it is commonly present in the bakery items, or it is in some dairy products. So excessive consumption of which can lead to formation of dense plaques, which is rich in the lipids, what we call is cholesterol. So that can become unstable, and these plaques we call as unstable plaques. And these unstable plaques can rupture once there is increase in the stress in the form of high blood pressure, increase in the mental stress also, physical stress also, and these are prone for rupture, and this can lead to development of heart attack. So it is dietary cholesterol level, although it is not having a linear relationship with your blood bad cholesterol, but yes, saturated fat and trans fat, if it is excess in the diet, can lead to development of blockages, and that can make your blockages unstable. So it is very important this dietary bad cholesterol should be kept under control.
All right. Well, thank you so much, Doctor, for that, and doctors for joining us today, sparing your time to talk to our viewers about these very, very important issues. Thank you all for watching at home. Goodbye.